Welcome to Ask Dr. Geier Live. It is that time once a week where I answer your orthopedic questions, whether it's about an injury, a surgery that you may or may not need, whether it's the recovery from that surgery, recovery from that injury, rehab, whatever. This is the time to do it. The only time and place I do that every week. My name's Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, anti-aging and regenerative medicine expert, and media medical expert. I help you feel and perform your best regardless of age, injury, or medical conditions. Beautiful day here in Charleston, South Carolina. I hope it's beautiful wherever you are. Remember, as I always say, this is not meant as medical advice. This is only for general information and educational purposes only. I haven't seen you, examined you, looked at x-rays, MRIs. I'm not your doctor. You're not my patient. I'd love for you to be my patient. You're welcome to come to Charleston and see me as a patient. I can talk to you about all your options, not just cortisone and physical therapy and surgery. Information about that, the link to my website is in the description below this video. Georgia says, hello from Greece, finally doing a little bit better, still about 6 months post-op. God, time flies. It wasn't that long ago that Georgia, that you and I were doing, we talked about that. But if you have any questions, leave those in the chat. I said this last week, but I for some reason, I had to look for something in my old Ask Dr. Geier live shows, and I see all these comments, and people were saying, how do I get my question answered? And they didn't, you don't leave them in the comments. I can't see your comments on YouTube. All I can see is the chat. That's what comes through on Restream, which is what sends this out. So if you have questions, they've got to be on Restream. Also, once it's over, obviously, I can't go in and answer the questions, so that doesn't help. You got to ask them now. Lots to talk about. Remember, if you haven't checked it out, and I'm going to stick around as long as there's questions, and if there aren't any, then this will be really short. On Thursdays, I've restarted Better Than Ever Live, but I tweaked the format a little bit. Now that I have obtained that third board certification, only the second orthopedic surgeon in the United States to be certified by the American Board of Anti-Aging and Regenerative Medicine. It was brutal. Written exam, oral exam, about a year's worth of studying, but got that done. But now I want to use that show to talk about what I call anti-aging orthopedics. So more than just cortisone, more than just physical therapy, more than just these arthroscopic surgeries and joint replacements. I want to talk to you about things that are out there, not promoting them, not even saying I necessarily would do them with people. I just want you to know what they are. So we're going to talk peptides in various shows. We're going to talk exosomes like we did yesterday, exosomes and rotator cuff tears. We'll talk a little bit about why I'm not so big on cortisone shots, why I'm not so big on arthroscopic cleanup surgeries, and a lot of different things. But if you have aches and pains and body injuries and want to hear about some of the newer things, what are coming in sort of tomorrow's medicine, but that are available today, join us 5 p.m. Eastern Time every Thursday afternoon. So, Aman, I cannot see the question. Again, put it in the chat. I can't see the comments. That's what I was just saying. Donald, good to see you. I'm curious where you are, Donald. I know where Georgia is, and I appreciate that I've been helpful. I certainly hope so. Send details, X-ray, and Instagram. Yeah, I don't actually use Instagram, so I am not going to see it there. And I don't, like I say, this is the only place I answer questions. I don't do it in response to emails. I don't answer questions in the chat or in the comments to any of the videos I do. I just don't have time to do that. So Lalu, L-A-L-U, if you have a question, this is your time to do it. I can't look at X-rays and MRIs in this format, and I wouldn't do that Instagram anyway. Mon says, I want to get rid of shin splints. Yeah, that's a tricky problem. That's an inflammation of what's called the periosteum, the lining of the bone of the tibia. You typically see it in runners, but you can see it in jumping athletes as well. Physical therapy can be fairly helpful. Stretching out the anterior compartment muscles can be helpful. That's how I got over it when I was a runner back in my college days. The other thing that I've used in my newer practice that can be helpful, not everybody has access to this, but you could do shockwave therapy. That may be something to try. The other thing that I always tell people with lingering shin splints is sometimes it can be not the world's worst idea to get an MRI at some point, make sure it actually isn't a stress fracture. they tend to examine differently, but those are sort of the things I think about. Yeah, especially Aman says it's been almost a year. Worth thinking about. Sandstut, I hope I'm sure I'm not saying that right. Cricket, that's awesome. I wrote in my book, That's Gotta Hurt. There is a chapter, one of the stories. Check that out. You can find it on Amazon, Barnes & Noble, places like that. My publisher published it in 2017. But there's a story about a very famous death in the sport of cricket. 50% partial tear of my ACL, lateral meniscus tear, consulted 2 doctors. One said surgery, one said physio. So a couple things. There really isn't such thing. Partial ACL tear is highly misleading. That's a radiology term and sort of a structural term, meaning like if you were to somehow look in there, half the fibers would still be intact, half would be torn. The problem is almost always with a knee and an ACL injury is even the fibers that are technically intact are now stretched out and the knee is still unstable. I haven't seen that many partial ACL tears that actually did well without surgery. There's usually ways you can see that on an MRI based on what's called the bone bruise pattern and where there are bone bruises. There's a very characteristic bone bruise pattern, even with partial ACL tears, that tell you it is actually a complete tear. Meniscus tears along with that probably make that fairly unlikely that surgery is going to give long-term benefit. Pain from the meniscus, instability from the ACL. I hope you do pretty well, but I think that still, and again, I've transitioned to more trying to help people avoid surgery. That's a tricky one that very likely wouldn't do well without surgery. Now, there are some things that help people speed recovery in my world. So if you ever wanted to come here, I think I could get you better, faster after you have the surgery, but that's a whole other story. Let's see. Priscilla, good to see you. Furman. I actually have a patient that spells Furman exactly the same way. Entrapment of the Colonial nerve. I don't know that I have ever seen that as a patient. Now, maybe that's one of those things that people have presented with that, and I thought it was something else. I haven't actually seen that. Generally, with any kind of nerve entrapment, kind of the more common one that you would see would be the saphenous nerve of sort of the medial thigh is probably, and you know, sometimes you can do cortisone injections around the nerve to kind of calm it down and see if that frees up symptoms. But in theory, with nerve entrapment, you release the scar tissue or whatever it is outside that nerve that's compressing it and free up pressure. I have never, heard of that as a problem specifically with that nerve or ever heard of people needing surgery for it. It's not to say that they couldn't. Lalu, parkour, accident, broke my forearm, radial fracture, Sri Lanka. Oh, very cool. You may be the first person that at least I've known about that has commented from Sri Lanka. Thank you for being here. Really, really excited. Not sure what time of day it would be over there. I would imagine it's fairly late at night. Radial fracture, so that's the bone on the side. So there's 2 bones in the forearm. There's the ulna, that's the side on toward the little finger that makes up the tip of your elbow there, your olecranon. And then the radius is this bone on the side of the thumb. Typically, a lot of times if it's an adult where one bone's broken and not the other, sometimes you can avoid surgery. That's a lot less common with the radius. Very often you need surgery, even if it's a radial shaft fracture. If it's a distal radius, sometimes that can line up. You can sort of set it and line it up pretty well, but a lot of them can't be. They're not stable, so a lot of times that needs to be fixed with a plate and screws. It's hard for me to really say because you'd have to see the x-rays. Fortunately, though, even if it needs surgery, that surgery does pretty well, usually an outpatient surgery, or maybe you stay overnight 23 hours, and then you'd be in a brace or splint for a few weeks, and then depending on where it is, maybe up to 6 weeks. But typically people do pretty well for that. 2 weeks. So if it doesn't need surgery, typically bone healing time is somewhere 6 to 12 weeks, again, depending on age of the patient, what type of fracture it is, where in the bone that is. Donald, ACL reconstruction in January. So what is that? That would be 9 months ago. Cadaver grafts, is it common to leave a screw in the leg after surgery? Yes. On this Ask Dr. Geier Live, if you go back and watch my old ones, I'm not so big on cadaver surgery, the allografts for ACLs, just because of the much higher failure rate. I'd never do it on kids, teenagers, really young adults. I know that people do it on older adults. I'm not sure it's what I would want, and I'm probably older than most of my patients that tear ACLs. But that's a whole other story. Yes, if they fixed it with screws, those typically stay in. If you go in and take them out, then you have a hole, and no, they don't cause any problems typically. The only time screws become a problem is if that graft fails down the road and you have to do a revision ACL, then a lot of times you have to take the screws out. Diet, I love that question, Aman. And if I said Anan, it looks like Anan on my restream, but maybe Aman. Essential things to add in my diet for good bone health and recovery. Love this. I just had this discussion with somebody yesterday. There are some supplements that I think are helpful. You can get some of this from your diet. The problem is you probably don't get enough of it in your diet to be enough for what you need. There's a handful of things. The ones everybody knows about, calcium, love calcium, and if you can get enough calcium, that's great. I think vitamin D, critically important for bone health. It's important for so many reasons. At least in the United States, people say up to 80% of the population is vitamin D deficient. Almost everybody needs a vitamin D supplement. Magnesium, another one, very, very critical for bone health. So vitamin D, calcium, vitamin D, magnesium. Couple though that you may not think about for bone and joint health, not so much in building bone as much as to stop inflammation that damages these structures. So epigallocatechins that are in green tea. The problem with green tea is there just aren't that many epigallocatechins, e.g. CGs, in green tea. You'd have to drink a barrel of it to get enough. So that I feel like can be really helpful as a supplement. Curcumin, the active ingredient in turmeric, same thing, not that much curcumin in turmeric, so you'd have to eat a ton of it, and I personally think it doesn't taste very good. So a curcumin supplement I think can be very helpful. When we're talking things like, and I know this isn't what you're asking, Aman, but things like osteoarthritis, I feel like omega-3 fatty acids, fish oil can be really helpful. A high-quality fish oil supplement. It's been shown in research studies to be one of the most anti-inflammatory supplements as far as osteoarthritis. We know of it for the heart and cholesterol and triglycerides, but could be very, very helpful as well. I think a collagen peptide supplement also could be very helpful. Collagen protein, there's some debate about how well that's absorbed by the stomach and GI tract, probably not very well, but there's a collagen peptide in particular that's been well studied. Fortigel out of Australia that is a form of collagen peptide. There's one company in the United States that makes a collagen peptide supplement. We have it in our office, and I'm sure there's a few other places that have it. Those would be the ones that I think could be very helpful. They recommended, I forget, yours was the radius. They recommend surgery. Yeah, here's the trick with surgery is that you really want to do surgery within about the first 2 weeks of surgery. He or she say recommended surgery, and I thought I saw it 2 weeks out. Yeah. The longer it goes, the more it's going to heal. Then you have to sort of scrape out the healing tissue to line it up better and then put it in the right place. So you typically try to fix it as soon as you can after the injury. Yeah, Georgia says, sorry, I was reading because I'm all out, all my comments are all over the place. I can help speed recovery. I would have come all the way there. Yeah, there's some things that I think can help people decrease the inflammation after surgery so that their knee or shoulder, wherever it is, doesn't, after surgery, it's all inflamed and swollen and it hurts, and that creates its own reflex inhibition of the muscles, and then the muscles get weak. So I really work to decrease that inflammation to promote healing, but then also really work to strengthen the muscles around that joint more. I love physical therapy. I think it's great, but there's ways you can speed that up even a little bit more. So yeah, I love helping people. I don't really operate that much anymore. I really love what I'm doing now, and don't miss the stress of surgery. I love the procedures. Didn't like any of the stuff around surgery, the making sure the orders are there and dealing with are the reps there, and do these nurses know the equipment. I don't miss that at all. And so, but I do really enjoy helping people get through their ACLs, through their even knee replacements, hip replacements, shoulder rotator cuff repairs, faster than people that don't work with me. All right. It is 9:42 in Sri Lanka. Very, very, very cool. And if I don't know if it's Lalu, I don't know, but thank you for joining us. Since been in therapy more than 3 months, relief pain, don't feel confident. The knee feels unstable a lot of the time. Hang on, the partial tear of the ACL. Yeah, so the pain, swelling, don't feel confident, and it feels unstable. That makes me think that non-surgical treatment wouldn't work. Again, I haven't seen that many partial ACL tears where the knee was still stable, even though, yes, by MRI it showed some of the fibers still intact. Imagine a rope that ruptures and maybe there's a little bit hanging on. Those few little strands are stretched. They're not stabilizing, in this case, the knee. So that actually doesn't surprise me that much. You are so welcome, Aman. I very much appreciate it. Donald, is heterotopic ossification common after knee dislocation? That's why I needed ACL reconstruction. Hit by a pickup. Right leg has 2 rods. 13 screws. Yikes. Heterotopic ossification, I have not seen much after, and I don't know if you mean full knee dislocation like ACL, PCL, MCL, and or LCL. Typically, it's 3 of the big 4 ligaments, or patellar dislocation, the kneecap. I have not seen heterotopic ossification with either of those nearly like what you see around the hip and the acetabular fractures and things like that. Doesn't mean that it couldn't. I just haven't seen that much. I'm assuming hit by a pickup truck, right leg has rods and screws. Maybe that's a femoral nail and a tibial nail and screws locking that in place on either side. You are so welcome. Very, very glad I could help. Dilip, I don't know how that is. I don't know what bone that is. The tubula fracture. Plate is still there. There's either a tibia, which is the shin bone, or the fibula, maybe is what they're talking about, is the small bone on the outside. Plate is still there. Bone doesn't join. I don't know necessarily what that means. Typically, we don't. If it's at the ankle, we don't take hardware out unless it's causing a lot of pain, which sometimes you see in like really young, thin women that don't have a lot of fat over that area, and it just, the screws and plate become very prominent. But 95% of the time we just leave it alone. So it would depend a little bit more on what is going on. Aman, can icing do damage to the shin bone? Polyethylene bag, yeah, what you put it in doesn't really matter. No, it's not going to do any harm. I am a big fan of ice for a lot of things. Some things maybe not as much, but that I do feel like would be helpful. All right, this is great. I am going to kind of wind up here. Let me take Aman's comment, dang it, off the screen here. Try to anyway. And I will wrap up. If you have any last questions, I will try to answer those. It was good to see you too, Georgia. I'm excited about my weekend. If you like this type of thing, have orthopedic questions, know people that have orthopedic questions, have them come every Friday, 12 p.m. Eastern time. Make sure you subscribe and ring the bell to be notified, because some days I am a couple minutes early, some days I'm a couple minutes late, like I was today. So you would know when I'm online. It also tells you when I release a new video. Also, remember, Better Than Ever Live, Thursday, 5 p.m. Eastern time. That's where I talk about some of the new things in tomorrow's medicine that are available today, what I call anti-aging orthopedics. A lot of fun. If you do want to see me as a patient, I would love that. The information to my website, drdavidgeier.com, is in the description below this video. I get people, in fact, I was in the office a little while ago, somebody that came into town to see me. So probably a quarter of my patients come from outside of the Charleston, maybe more than that. Probably a third of my patients are not in the Charleston area. So love for people to come down. Charleston's a beautiful place. You'll really like it. So Donald says, Lachman's test is an ACL test. The bone still moves and shifts. Yeah, if the Lachman's test is positive, that makes you think that the ACL is not stable. It's hard to say, though. I mean, if it's just a little bit, that's one of those that I need to feel it. I need to feel that Lachman's test and see. But that's what they're looking for, is to see how stable that ACL is. You are so welcome, Aman. No worries. People have come multiple times for questions. I'm happy to help. All of you have a fantastic weekend. I hope to see you Thursday. Actually, I am not going to be here next week. I apologize. I'm glad you guys said that. I've got something Thursday and Friday, both days, that I'm not going to be here. But in 2 weeks, I will be back. So I really appreciate you being here. And Donald, you are very welcome. I will see all of you very soon. Have a fantastic weekend.